So imagine this, you're like 35 to 39 weeks pregnant and you go in for your prenatal appointment at your OB or midwife's office, and the nurse says, oh, here's your patient gown, you go ahead and put that down and take off your pants and underwear. Usually when they do that, that means that the provider will probably want to do a cervical check. So let's talk about this. Do we need this? One thing you need to know about cervical exams is that it is not a crystal ball. The results of the exam doesn't tell you when you're going to labor, it just tells you where you are now. So you could be 1 centimeter and maybe go labor that week or the week after that. We don't really know. You could be 5 centimeters for a couple weeks and still haven't gone labor yet. If you want a cervical check because you're like really curious where it is, that's totally fine. Then go ahead and put it on the patient gown. If you don't want it, then you don't have to put on the patient gown, because when you put it on, you're kind of giving implied consent that you're okay with it. But even with the gown, they still have to ask for your permission if you want a cervical check or not. Keep in mind with a cervical check, some people find it painful or uncomfortable, or they experience a little spotting or a little bleeding. That's a variation of normal, but that can make some people nervous. A good reason for a cervical check is if you are considering an induction or your provider starting talking about induction, then you can ask what your Bishop score is. So that means they are checking to see if the cervix is soft or hard. And they're also checking to see if the cervix is posterior, anterior. They're checking how dilated, how infaced you are, and like station, things like that. And the higher the score, the more likely that the induction will be successful. The lower the score, it just means that they might have to do like cervical ripening to soften your cervix for labor and give your body more of a nudge to be like, hey, let's go to labor. Bishop score in that case could be really helpful in deciding when you should schedule your induction. You go into your prenatal appointment and there's offering, if they offer a cervical check, you can say, yes, I'm okay with that because I'm curious, or yes, I'm okay with that and I would like my Bishop score. Or, no, I'm not interested in that unless there's a medical reason. Or, no, I'm not interested in it at this time.